Hello, I'm Peg Bulgioni, Communication Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. The focus of our show will be on the Pulmonary Rehabilitation Program. I will be speaking first with Lisa Taylor, Pulmonary Rehab Coordinator, and Kim Baptie, Respiratory Therapist, and later with two participants in the program. I am also proud to announce that Rutland Regional Medical Center is one of 3 Vermont hospitals to receive the Health Grades 5-star rating for the treatment of chronic obstructive pulmonary disease for 3 consecutive years. We will be right back after this message from Rutland Regional Medical Center.
Being pain-free has made a huge difference for me. I'm Amanda Bodell from Waltham, and I'm a patient at the Vermont Orthopedic Clinic. I've had 1 knee and 1 hip replaced. I was exhausted because I had to think about every step I took, and now I can walk with confidence. I really think that these procedures have been almost life-changing for me, giving me an opportunity to do the things that I like to do without pain. I am very happy with the care that I received at Rutland Regional Medical Center and Vermont Orthopedic Clinic.
Welcome to Window on Wellness. I'm Peg Bulgioni, Communication Specialist with Rutland Regional Medical Center. And today our program is going to be focusing on the Pulmonary Rehab Program at Rutland Regional Medical Center. And I am pleased to have with me 2 folks that work very closely with that program. Kim Baptie, she's a respiratory therapist, and Lisa Taylor, who is the Pulmonary Rehab Coordinator. Ladies, welcome to the show.
Thank you.
So I think we're just going to dive right in because we have a lot of information to cover. So perhaps you can explain what the program is. What is pulmonary rehab?
Pulmonary rehab is for patients who have any form of lung disease. So predominantly it's COPD patients, but we can have lung cancer patients, patients with pulmonary fibrosis, different types of lung disease. And education, exercise, help them to decrease their symptoms, and socialize with other patients that have this, or they're in the same boat. So it doesn't make them feel so alone and isolated.
All right. Well, maybe you can talk about sequentially, what happens if a person is participating in the program? What are the steps? So maybe we can go from A to Z.
All right, so when they first come in for the day, we do their vital signs, get their weight, and then we start off with some chair exercises. So they either stand behind the chairs, or some of them sit in the chairs, and we do some endurance arm exercises. From there, we do leg weights and arm weights, and then we do some aerobic activity. So there's treadmill, there's stationary bike, another piece of equipment called a new step. And after that, they have about a 5-minute time where they rest and they can have some water. And then we do education for the last 45 minutes.
And so what is the education? What does that involve?
So there's a different topic every day. There's medication review, infection prevention, there is oxygen therapy. We have our social worker come and talk with the group on emotional well-being, advanced directives. We have a occupational therapist come who does energy conservation, and then we also have Aaron Jones from Dietary, and he discusses nutrition with them.
And how many people usually participate in this program?
We can have up to 8.
Up to 8 people.
So what are you at currently for numbers?
Right now we are phasing it down till 1st of December. We'll be done at the end of this November. Normally it's a rolling enrollment. So as soon as one finishes up, we get another one in, and it just keeps going. But with holidays in December coming, a lot of patients or participants, they would rather spend it, not come in, and they've got family coming in and that. So we've decided this year to just let December kind of be that downtime. We can get things finished up, and
then they'll start up again in January.
Start up again right after the 1st of January.
What I thought was interesting is there are some people that have been doing this for years, and others that have just started the program. Is that typical that people would be in it for so long? Or it's the wellness piece, I think.
Yeah, it's the wellness. So there's different phases. There's phase 2 is the actual where they're first coming in. We try to get them when they've just come off of maybe a big illness, or people who have been on oxygen for years and then their symptoms are getting worse. So our doctors will say, you need to go to rehab. So it's roughly about a 6 to 8 week program. And once they meet their goals and they're discharged, then we encourage them to come back for the phase 3 program, which is wellness. And at that time, they could be here for several years if they keep coming back. And those that do come back, we don't ever see them on the inpatient side. They stay, their health is, they stay well.
Yeah.
And that's what we're really trying to focus on, is to keep them well.
Right, right. And again, you've got a real cross-section of, patients and various medical conditions. What do people, I guess, what is their primary goal, when they go through the program? Is just to maintain or to go beyond that?
I think our primary goal is to give them a greater independence at home. So make it so that they're able to do more of their daily activities and have less shortness of breath and be more independent in their daily life.
I don't know if you can quantify this, but, how do you measure the success rate with patients?
We have a lot of outcomes that that we look at. So each person has an individual goal that they set for themselves. Some of it is that they just want to be able to walk further, or they want to experience decreased symptoms, and so those are the things that we'll track. We'll do things like 6-minute walk tests where, beginning of the program, they're able to walk this many feet in 6 minutes, and then we'll do it again at the 30-day mark, and then again at the end, and see how much they've improved. And then we also have other questionnaires, quality of life questionnaires, nutrition questionnaires. These things are periodically done, and shortness of breath questionnaires. So we can keep track, are we improving? If those scores are improving with them, then obviously that their perception of their symptoms have definitely decreased, and that's what we're looking for.
Now, how do people get involved in the program in the first place? They have to be referred by their primary
physician. It
Okay.
can be a primary care, it can be a pulmonary doctor.
Okay.
They'll send a referral and we'll get them in.
And so what is the age spread of folks that are involved in the program?
Anywhere from early 50s to late 80s. We've had some come in the wellness part of it, the phase 3 part of it, up until 90. But that's, as far as the rehab part, it's such a big age range and differences in their illnesses too. So
Right. So I guess, as, medical professionals, what if somebody was watching us right now and was experiencing, some type of respiratory issue, what would you say to them about participating in the program?
you have to understand, the patients that we have here, they all have it's chronic. It's not just an acute it's something like the COPD that they've had for years and years, or patients who have had lung cancer that are being treated, or who maybe have recovered but still have a lot of symptoms post.
It may also be important to mention that there's criteria for insurance to pay for this. So they at least have to have grade 2 COPD. There's different criteria that they do have to meet to get into the program.
Any other final takeaways before we wrap up? Just about pulmonary rehab, about the patients, or just in anything in general?
It's a good program. I mean, and unfortunately, not enough people take advantage of it, and not enough physicians, and I'm not talking specialists, but primary care, not enough of them actually utilize it for their patients. So I can't remember what the statistics were on that, but it was pretty low. And so there's a lot more people out there who have these respiratory or pulmonary diseases that could benefit from it, and they just maybe need to reach out to their primary care if they think it's if they'd be able to qualify to participate.
Okay, good. Well, thank you. Thank you both for being on the program and for sharing this very important information. Welcome back to Window on Wellness. I'm very pleased to have one of the participants in the Pulmonary Rehab Program from Rutland Regional Medical Center with us today, and Linda Booten. I'm so pleased you could join us.
Thank you.
And I know that you've been a participant in the program for, why don't you tell me how long you've been in the program?
I started the classes in the spring of 2016.
Okay. And how has this program benefited you?
I feel better. I feel better about myself for just participating. If I didn't have this program, I probably would not be exercising. It's not something I would get up and go to the local gym and do.
So how long, maybe just kind of walk me through what you typically do when you come to the program.
Okay, I do generally just 3 pieces of equipment. I do the treadmill for 20 minutes. That generally gets me a little over half a mile. And then I will ride the bike for 20 minutes, and that generally gives me about 6 miles. And then I use the new step, and that gives me another half or 3/4 of a mile.
So how long do you do this?
I usually am here for about an hour and 20 minutes or so.
And how many times a week?
Twice a week, Monday and Friday.
Okay. Is there anything more to the program than just the exercise piece?
In the beginning, we had classes where we came, I think it was 3 days a week for a couple hours, and we learned about nutrition, and we did various exercises with our arms and our legs, and we had informational things that they did for us. We had a occupational therapist come in and helped us with some of the exercises. They put us through our paces.
I bet. So were there any particular challenges of the program that you had to deal with in the beginning?
It was just, I was having difficulty breathing, so I had to learn how to breathe correctly while I was doing the exercises so that they would benefit me more.
Now, do you have, is it COPD?
Yes,
Okay. You've been going through the program for
about 3 years.
3 years, okay. You know, you started off, it must have been challenging because I don't know if you've ever exercised, at this level before, but I know with anybody adapting to a new program, it's got to be a little difficult at
It was
first.
in the beginning, just getting accustomed to doing the exercises, and I did them during the classes. I would do them at home also in between
Good.
the classes.
Well, that was the other thing I was going to ask you about is the maintaining. So you do it other than what you do it here.
Yes,
And so now that you've been through it, and so how do you feel?
I feel a lot better.
Yeah. And so if you had to kind of quantify the successes of the program, what do you feel has been the most successful for you?
It gets me out and moving and doing exercise, which otherwise I might not do.
Yeah. And would you encourage other people that are in a similar position or have been in a similar situation for you to participate in this program?
Oh, definitely. I've seen a big benefit, and I've had friends tell me they can tell whether or not I've been exercising. My voice changes when I don't exercise.
Really? That's
Yeah.
great. And has it improved your medical condition?
I don't know if it's really improved it. I'm at a stage where it probably can't be improved, but I can do better with what I have than I did before.
All right.
So
That's great. That's
I've
great.
enjoyed it, and I appreciate the hospital having this program for us because it does make a difference in my life.
Oh, that's good to hear. Did you have anything else, Linda, that you wanted to add?
No, just thank you very much for doing this because it's helped me a lot. I've made some new friends. We have a good time twice a week.
That's
You
great.
can't knock that.
That's true. That's nice to hear. Well, thank you, Linda. It's great having you on the program and sharing your story with everybody.
Well,
Thank
you.
you.
For letting me. Thank you.
I have with me Regine, am I getting that correct?
That's right.
Regine Perry. And Regine is also a participant in the Pulmonary Rehab Program at Rutland Regional Medical Center. And so, Regine, why don't you tell me your story? How long have you been doing this?
I am now working toward 18 years,
Wow.
and I have just been so blessed to know that this program works. And one of the things, let's get it out of the way right off, that really saddens me is the number of people who go through the rehab program and then never come back to wellness. I've always come back. I've met some lovely people, and I have to say that right now we've got the most amazing group of people in there doing wellness. We pick on each other every time we're together. We have great fun. If you're new, you might take a bit to adjust to us, but we care for each other. We have each other's phone numbers. If somebody doesn't show up, pretty quick you'll get a phone call. Are you okay? And I just, like I said,
That's wonderful.
I feel bad
Oh,
for all those who never tried to come back. Yes, it takes time. It's a commitment. But the benefits so far outweigh anything else, really.
so I know that I know that there's kind of a two-step process. They go through the
Yes,
rehab program,
right.
but then once you've completed the rehab program, then as you point out, there's the wellness piece.
Yes.
And people can come for as long as they want for the wellness piece.
We have wellness twice a week, Monday and Friday, at least from 10 until noon. You come at your own pace. You use the machines you want to use. You sit and chat with your friends. And our staff, we have wonderful staff looking out for us. And they're amazing people too. And we get them laughing. It gives you such an uplifting feeling
That's great.
to know that people care about you.
Mhm.
But the most important thing about that is probably none of us have exactly the same issues,
Mhm.
but it's all lung related.
Mhm.
And so we can more fully understand what the other guy's going through,
Right.
because you can't understand what we're going through, not really.
When you first started the program, what were the challenges that you were dealing with?
To try to be the best I can be and to go as long as I can with the program.
And this has made a tremendous difference in your life.
Yes.
Yeah.
And there have been setbacks
Mm-hmm.
so that I haven't been able to come, but I've always come back as soon as my body said, you've got to get back there.
So if you were to tell people, kind of some final words about the program, what would you say?
What would I say? I would say God has blessed us with amazing staff to watch over us, wonderful friends who understand what we're going through, who care about us. They might send you a card if you're out for a bit, or you'll get a phone call. You never know.
Oh.
But they're always glad to see you back.
That's great. Thank you so much, Regine.
Well, thank you. I appreciate this.
Thank you for joining us today. Please continue to watch Window on Wellness each week on PEG TV, Channel 15, and on demand at pegtv.com.
I've been a ski racer since I was 6 years old. The first time I hurt my knee, my ski just got caught in the snow and my knee twisted and tore my ACL. I knew from the moment that I got hurt, I could trust my doctors and I could trust the care that I was getting at Rutland Regional Medical Center and Vermont Orthopedic Clinic. There was no doubt in my mind that I was getting the best care. And after I had surgery to repair my ACL, I was back ski racing within a year. I'm so grateful to have such high quality care so close to home.